Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. So let's get started into the video. Today's topic is about interpersonal relationship. So interpersonal relationship is nothing but when we are considering about the healthcare settings, or in the environment in the hospitals, we as a medical professionals, we have to maintain the interpersonal relationship with the patients, clients, and the patient's relatives, and who accompany the patient. Everyone, we have to maintain a relationship. So when we are maintaining this interpersonal relationship, there will be a smooth transition of the communication, or any kind of activities will take place in the hospital among the care seeker and care provider. So let's get started into the video. We'll see one by one in detail. So what is meant by interpersonal relationship? So it is the learning experience whereby two people interact to face an immediate health problem to share, if possible, in reversing it in an adopt a situation. So in interpersonal relationship, it is a learning experience among two people. So what happens if there is a communication among two people? One people will be asking about any questions or any ideas, or there will be a sharing of ideas, or communication will take place. That is in simple term known as interpersonal relationship. So definition: interpersonal relationship is defined as a close association between individuals who share a common interest and goals. Another definition is interpersonal relationship means interaction or relations between two or more individuals. So here it means when the two people are interacting, or when they have a common goals on, and when they are interacting among themselves to achieve that particular goal, that is known as interpersonal relationship. So if you are considering about the health environment or a medical environment, so for example in hospital, a physician and a patient is talking, or a physician and the other healthcare professionals like nurses or physiotherapists are talking, or if they are discussing, their main motive is to cure the disease of the patient, and their motive is to reduce the stay of the patient's stay in the hospital. So that is the main goal of every individual. So patient also wants to get cured very quickly, and they wanted to go home. So that is the main motive. So both will be sharing a common goal. In achieving that goal, they will be interacting. That is known as interpersonal relationship. So next is purposes of interpersonal relationship. So why we have to maintain the interpersonal relationship? So first one is, it's a source of enjoyment. For it is not that only we have to think about only curing of diseases, or accomplishment of any goals, but also when we are maintaining this interpersonal relationship, so you should not consider only the hospital setup. You can even consider the administrative level and hospital college levels everywhere, or in a place where two persons share among themselves for the motive of common goals. So fun is source of enjoyment. So when they are maintaining the interpersonal relationship, there will be a sharing of ideas will be there. So that is going to be a source of enjoyment for two parties. So next is sense of security. So what happens is, when there is a sharing of ideas is there, so one will be feeling secure. One will be thinking that okay, we are working for the goal completion, or whatever I am telling to them, I will feel secure. So that is the maintaining of interpersonal relationship. For example, if any patient is admitted in the hospital, so now and then they will not explain about themselves. They will not reveal completely about themselves to the healthcare personals. So they need some trust. So that will be created only when we are maintaining the proper interpersonal relationship. So next is personal growth and development. So when we are maintaining the interpersonal relationship, there will be a growth in personal as well as the professional development. Next is mutual understanding and cooperation. So when we are maintaining the IPR, we'll be developing our communication skill, and thereby when we are communicating with other members, our common motive will be fulfilled, our common goal will be fulfilled. So once we are seeing that interpersonal relationship is in a very healthy manner, we come to know that there is a mutual understanding between two members, and there will be a cooperation among two members. Okay, whatever we are discussing, it is quite good for the long term goals or completion of short term goals, like that. Next is improved decision making. So once we are maintaining the good interpersonal relationship, there will be an improvement in decision making. So like trial and error method. So one will be telling the suggestions, and one will be like, we are going to do the constructive criticism. So next is developing the comfort. So once we are maintaining the interpersonal relationship, there will be a comfort, there will be a trust among the other person. So that what happens, we'll be revealing everything, we'll be sharing our ideas, and we'll be very genuine, and in that cases we will improve our comfort and trust among the people. So next is facilitating communication. So once we are maintaining the good IPR, automatically the communication will also get improved. Next is improving socialization. So once we are maintaining interpersonal relationship, we will get socialized. We will not be withdrawn. Will not be like will not be in a state of depression, but we'll get socialized. We will talk with others. We will share our ideas and everything. So next is fostering trust. So once we are developing the good IPR with anyone, whether it is a patient or the relatives or any other healthcare professionals, once we are maintaining the good IPR, automatically the trust will be developed. So if the trust is developed, we will be very comfort in revealing all the informations to the people who are asking us. So next is types of interpersonal relationship. So one is casual relationship. So like casual is, it does not have any motive. It is very casual. Like we have the friendship in our workplaces, or when we are just visiting any malls or any kind of hospitals, even the hospitals. So one time we'll be meeting them, just having a small smile, just having a small interaction. That is a casual relationship. Next is friendship. So friendship, there will be no any serious motive, but will be having the same goals. Next is family and kinship. Professional relationship. So once we are maintaining this IPR among our professionals, like in hospitals or colleges or any administration or any companies, like that, that is a professional relationship. Next is love. So among our loving personals, when what relationship we are maintaining, that is one type of IPR. Next is marriage. So marriage is also a bonding of interpersonal relationship. So these are the different types of interpersonal relationships. So if we are talking about interpersonal relationship, it is not only limited to the hospital setups or any college setups or administration, but also in day-to-day life we are communicating with our loving members, our friends, our professional colleagues, or our even the spouses. So that is also one type of interpersonal relationship. So principles of interpersonal relationship. So first one is learn everyone name and respect everyone. So we have to respect each and everyone irrespective of their cadre, irrespective of their caste, creed, color, religion, nationality. So we have to respect each and every person. So individual respect is everywhere needed. It is not that we have to be very rude and arrogant, and that in that cases the IPR will not be properly maintained. Next is keep the emotions under control. So when we are maintaining the interpersonal relationship, for example, if we are maintaining the IPR among the patients, so as a healthcare professionals, they will be revealing about their own personal informations, and that will be very, sometimes it is very heart touching, heartbreaking. Sometimes they'll be telling the instances, it is like gut wrenching instance they'll be telling us. But in that cases, we should not be very emotional. We should not behave to the exact emotions of what the patient is telling. We have to control our emotions, and we have to listen, actively listen to what they are telling. Next is developed habit of listening and focus attention on problem. So our main motive is to identify what is the problem, and we have to give the suggestion or any or develop any kind of suggestions for the problem. So we have to actively listen what the other member is telling. Next is give importance others and practice justice. Establish a good rapport among the members. Avoid argument in the group. Have a smiling face always. So yes, exactly, it is not that only the not only with the patients or only with the college personals we have to maintain this IPR. Even each and everyone the next to our persons we have to maintain this IPR. So this having the certain principles, that means we have to first respect each and everyone, we have to respect them individually, we have to keep the emotions under control, we have to be an active listener, and we have to give importance to others, we have to maintain a good rapport and good communication among others. So when we are maintaining these all and have a smiling face always, and we should not be judgmental, like you should not say in between like you are wrong and you are right, like that we should not say it, you should not be very judgmental. So you have to listen to them and carefully and identify what is the exact problem is. So next is characteristics of IPR. So first is trust. So trust is the most essential characteristics of interpersonal relationship. So once we are developing the trust only, the communication will be developed. Or else what happens if I'm going and asking about, if anyone is asking about our personal, do we tell them like revealing each and every aspects of our life? No. So once we are developing the proper trust only, we will reveal all the informations to the person. Next is maintaining the empathy, that is putting ourselves in others situation and think in that way. Next is caring. We should be autonomy and mutuality, we have to maintain the mutual cooperation among others. Next, it should be genuineness. Characteristics of IPR is mainly depends upon the genuineness. Next is possessive warmth. We have to maintain the warmth relationship among the other person, then only they can reveal all the information to the persons, and they will reveal all the secrets among them. Any kind of counseling needed, we can tell them. Next is phases of interpersonal relationship. So Hildegard papleu 1952 gave the interpersonal relationship model. So her model describes the phases in a nurse-patient relationship in terms of interpersonal process. So first phase is orientation phase. Next is identification phase. Next is exploitation phase, and last is resolution phase. So we'll see one by one in detail. So Hildegard papleu, she in 1952 gave a IPR model. So interpersonal relationship model, how the relationship will develop in a sequence. So first one is orientation phase. So the nurse clarifies his or her roles and responsibilities, identifies the patient problems, and develops a trustworthy relationship. So when we are admitted in the hospital, the nurse will maintain a good IPR among us. Like first they will wish, they will introduce themselves, they will give a warmth relationship, they will maintain a good rapport, they will maintain a good communication. So once we are developing these all, this is one kind of interpersonal relationship. So automatically we'll trust on that particular nurse, and we will tell everything about us. So next is identification phase, second phase. The nurse helps the patient to identify their problems and use the available resources. For example, they'll be telling like I have abdominal pain or I have a headache, like that. So based on the signs and symptoms, they will help us in identifying what is the exact problem is and use the available resources that is available. That is, for example, in hospitals there are available resources like MRI, CT, other diagnostic techniques. So that all will be utilized based on the need and problems of the patient. So next is exploitation phase. So in this phase, the patients are made to understand the problem by exploring all the available avenues to solve the problem. So once we are identifying the problem, then we will encounter that problem by using the available resources and curing those problems. So resolution phase is a termination of professional relationship. So once the patient get cured, we will do the termination of that particular relationship. So So here what happens is, first is orientation, where the patient and the nurse will get oriented. Then they will identify what is the exact problem is based on the identifying the needs and problems of the patient. There will be exploitation phase, that is use of available resources to cure that particular disease. So if that disease is being cured and their health condition is being improved, that will end up in the resolution phase, that is termination of that interpersonal relationship. So barriers of interpersonal relationships. So every relationship or communication have a barriers. So first one is personal barriers, so gender. So for example, a male patient cannot reveal everything to a female nurses and vice versa. So in that cases, the gender is one of the problem in revealing or a trust, to maintaining or developing a trusting interpersonal relationship among the patient or nurses. Next is lack of honesty, feeling of insecurity, ineffective communication, fear of rejection, distorted self concept. So sometimes what happens, the patient will be thinking that if I'm revealing this to the nurse, what they will think about me. If I'm revealing about this to them, what the other persons will think about me. Like that, they will have that inferiority complex, and this is one of the personal barriers that is being faced in the interpersonal relationship. Next is situational barrier, complex interactional settings, like there will be very noises, or sometimes they cannot understand what the other person is telling. Next is lack of territoriality, high density of individuals. For example, if there is a counseling, they will be giving in a separate room, or in a hospital if they're asking, means what happens, if there is no any privacy, there is no any territoriality, they will not reveal. They think that what if I'm telling this to the nurse, other person will listen what I'm telling. So if it is lacking in that particular hospital or particular place, that time there will be no any effective interpersonal relationship will be there. Lack of time, increased physical distance. So someone is standing 20 feet away. If I'm telling to them, if I want to tell them in a very secret manner, what happens? It is not possible. If they are very distant, they cannot understand. There will be it is one of the barrier in interpersonal relationship. So these all has to be overcome to maintain the proper developing trustful interpersonal relationship among nurses or healthcare professionals and patients. Next is socio-cultural barrier. There is so we say no, like unity in diversity, or we have different cultures, so that also plays a major role as a barrier in interpersonal relationship, like cultural diversity, ethnic diversity, social diversity, language diversity. If any other language person is speaking to us, if I'm not understanding it, so how come I'll be making them to identify their problem using the available resources? So it is quite difficult. So these are all the some of the barriers of interpersonal relationship. So if we are overcoming from these barriers, a proper interpersonal relationship can be maintained to develop a or fostering a trustful or a comfort relationship among the healthcare professionals and patients. So, conclusion, interpersonal skills are the abilities that allow us to interact with others. We use them on a daily basis, so both personally and professionally. We can build relationships, resolve conflict, and create a positive work environment when we can effectively communicate and connect with others. So it is not that only the professional communication will develop, but also the personal communication will develop. So these barriers is also applicable for the personal interpersonal relationship. So someone wants to talk with them in a very intimate manner, or if anyone is standing of 20 feet or 50 feet away, how that other person will be thinking about telling about their issues. So it is quite difficult. So that is these all are the some of the barriers of interpersonal communication that has to be overcome to maintain the trusting interpersonal relationship. So interpersonal relationship is not only limited to only the professional, like nurses or patients, or doctors or nurses or patients, like that, but also the personal relationships like marriages, friendship, kinship, like that. So that's all about the interpersonal relationship. So far we have discussed about what is interpersonal relationship, what are the definition, what are the characteristics of interpersonal relationship, what are the principles of interpersonal relationship, and what are the types of interpersonal, that is phases of interpersonal relationship, like orientation, identification phase, and exploitation phase, and resolution phase, that is termination phase. And we have also seen the barriers of interpersonal relationships. So that's all about today's topic. If you have any doubt, kindly drop down in the comment box. If you find it useful, kindly like it, share it and subscribe it, and thank you for watching.